product that we're injecting into the correct area of the dermis. So we have adjustable needle that is 0.25 to 3 millimeters, depending if you're using biostimulator, something that you want to treat melasma with, and it's a PRP, an exosome, what have you. So we're able to precisely deliver as well as get it to the area of the dermis that we want. We also, on the device, have some memories here. So we have 1 through 4. So if it's something that you do quite often, you can do the presets there so that, especially for researchers or people that do 1, 2, 3, 4 particular procedures that they do all the time using this. Once they start getting it in their practice, they can preset to that. It also has an auto sensing. So it will not discharge unless it has a complete seal. So if I'm using this and I place it on the skin, it has to have a complete seal. So you get it exact amount dispensed in the area that's necessary without, wondering, did I hit 1.5 centimeters? Did I hit 3? Did I hit 0.25? If you were to do it manually, this takes the guesswork out of it for sure. So as far as cc syringes, depending on what you're doing, you can go all the way from 1 to 10 cc syringe. The reasons that I think are most common that people purchase the MedinjecT is to get, have their practice, kind of one up their practice, if you will, and get their med spa, in the game that's currently coming our way that, is very popular in Europe and Asia. Everything is combination therapy. We just don't do Botox. We just don't do a laser. We are actually combining things to get results that are phenomenal. So I can do micro Botox. I can do hyperdiluted. I like to use Versa HA fillers. We can use glutathione for lightening and brightening. We can use vitamin C for, to fight free radicals. There's a cookbook, exosomes, stem cells. There's a cookbook full of stuff that we can use to put in the syringe post treatments. So if you've done a CO2 and you want to do a PRP right after, and 2 weeks later you want to have them come and do some hydration, you do a hyperdiluted Versa. So that for, therapy wise, it's its own little menu. It's kind of like the Windex of my practice, because I can feed into it. I use it for hair restoration with PRP, exosomes, what have you. But it gives you that competitive advantage to take your practice to the next level. So it's not just single faceted. You're getting them a result. And once you give somebody a result that's amazing, they're yours forever. So that being said, that it's kind of like the icing on the cake for us, and it's served us very well. So you can see too here, when I shift the needle, it can go from 0.25 to 3 millimeter. And then I also have a 5-pin tip needle. Let me grab this. Sorry to come out of the frame here. But I have a 5-pin tip needle that is controlled by a foot pedal for hair restoration. And I'll show you that too. That's a 5-pin tip needle. And that comes in a 1.5 and a 4.5. What we're also looking at is coming down the pipe yet for biostimulators and for nanofat transfer for all us, our plastic surgeons who are really chomping at the bit for that. There is a 25 gauge needle coming out, which would be great for hyperdiluted radius, Sculptra, any biostimulator, PRP, PRF, you name it. And that things that we can do to also help with hair restoration. So that being said, that's going to come down pretty soon. And then we'll be able to do face, neck, chest with the biostimulators, legs, you name it. So it's kind of like an endless little, cookbook for your practice. And the add-ons just keep coming. I'll find myself in the middle of the night going, hey, I can do this. I can put that. I actually based a turkey with it 1 year just to send to the CEO. So That works too. But we have a lovely model here. One of my employees, Shannon, who's wonderful. And what we're going to do is show you, give you a little bit of a demo on how it works and how easy this is. So I'm going to get myself onto the other side here. And Shannon's good and baked now. Do you want that, Nate? Okay. All right. So Shannon knows what to expect, and she's also a good friend of mine. So Shannon would be able to tell me without reservation whether she wants to punch me or not, which this is, it does not, I haven't had anyone get off my table yet saying can't do it. It's too much. So I can't say that for everything that we do, but I'm going to clean off Shannon here.
And Gigi, maybe you could also touch base a little bit on the computer and the interface too when you get a chance.
So on the interface here, it's pretty simple. And I'm going to wipe off one side of Shannon's face first. Our little extra bath, and then we'll leave the numbing cream on for the other side when I finish her up.
And we have a question in terms of numbing cream. What is on her face now? So numbing cream is the answer.
I use a topical quad, but if you're going to do it post procedure, so if I decide that I'm going to do it post CO2 or something like that, where your numbing cream would wear off, then I would, you can do bundle blocks and, just in the area that you're doing. And that seems to stand pretty good for a good long time. So.
And if anybody else has questions, feel free to just write them in the chat and I'll relay them because Gigi can't see the chat.
So if you can see right here, this is where I have my presets and 1 through 4. Right here is where I can advance the syringe or back up, so I can purge it. Right here is my syringe size. So if I put that on, it'll be what size syringe I'm using. I'm using a 3 cc. I have 3 cc's of solution. So then I put 3 in and it lets me know right here how many shots I'm taking totally. Right here, skin type, whether you have a thin, general, or thick skin. It's not skin type 1 through 6 like it would be on laser, what have you. This is just the integrity of their skin because it's got some suction. This right here is the rate of speed I'm going, and I had speed level here. That's the rate that the product is going in to the skin, and this leak prevention right here is the viscosity of the product. So if it's a little bit more thick, I don't want it going in super fast because it has a little bit of an extra bite. So then I come by my standby, turn it on, my vacuum, and you can hear the auto sound. Now, I want you to see how lightly I'm actually, because I've primed Shannon already. Go ahead and turn this on.
And we have a question. What is your dilution for hyperdilute versa?
Depends on who I'm doing, how thick their skin is, and how dry it is too. But right now I'm at a 1 cc, 1 to 2. And sometimes I'll do half and, half cc to 2.5. So I love to use Versa on this because it is the most forgiving if, so watch when I skin. And if you can see, I'm barely touching it. I'm letting the skin, the automated injector sucks the skin up into the syringe. So I'm not grinding needles into Shannon's jawline or any of, to make it more uncomfortable. Not only that, you can hear that little beep, and that little beep tells you that it's completed a cycle. And so we're done with that there. So it's quite easy. Not too bad, Shannon?
No.
I didn't pay her to say that. but it's pretty easy, as you can see. So if you could imagine while you're doing these things, you want to do micro Botox for pore size, and it's actually got a tightening effect, or like I said, the glutathione for the lightening brightening, PRP for people who have melasma, but also for the growth factors. I use a lot of exosomes and stem cell for the hair restoration and for the face. So it's like I said, it's just a multifaceted, you know, device that I use all the time in my practice. One thing that I can say for this is that if you're looking at someone who's had just simple CO2, what I like to do is I like to get into full combination where I'll stack an RF microneedling with a CO2 and then do this on top. So that being said, it's, the results when you start to see are phenomenal, and just educating the patient because they don't know, like I said, they don't know what they don't know. So you see these little marks right here where the product has been injected. Those will be, gone in a day.
And Gigi, another question we got here is in terms of the rate you were using, the speed, was it a 6? Somebody was asking, or?
I have it on a 6, yes. Okay. So 6 or 7 if you have anything like a filler or you have PRP or something like that. If it's something more aqueous, then I'll use a 1 or 2. Like if I'm doing the micro Botox, I'm usually at a 1 or 2 because it's not viscous at all. It's very aqueous. So, because basically it's just the.
Yeah, and another question here is just injecting PRP for melasma. Maybe you can talk a little bit towards what are the most common materials you're using with the auto-inject here.
The most common is, PRP is one. I do a lot. I'll mix the Versa, probably the hyper-diluted Versa mixed with a little bit of the Botox, the micro Botox, so you can kind of kill 2 birds with 1 stone, which you can do. So that's always something, that you can combine that therapy. And I usually do that 2 weeks out of a CO2 for hydration. Now, if I'm doing it right immediately after, I'm probably going to do something like do the PRP or an exosome for healing to aid the growth factor, but also help with the healing process.
We have another question that. Sorry, we just had to mute somebody because there was a little background noise there. Oops. There we go. Yeah. So in terms of we're talking about we're showing really face right now, but in terms of like hair restoration, is that also something that you're commonly using in your practice? Is asking
hair restoration is big, especially with middle-aged women or men that have had transplants to help. But with hormone replacement therapies, stress, you name it, there's a million reasons why hair falls out. Sage, anesthesia, all kinds. We definitely encourage the use of this to help remedy that situation. And it seems to do quite well with either one. Exosomes. I have a couple hair transplant patients, and it has really, really helped with the fullness and, bumping up the results for their hair transplant to keep it the way it needs, keep it the way it needs to be. They paid a lot of money for that. And so we're going to go next for Shannon right here too. It's pretty easy. It's not such a bloody mess. Sometimes if you do what I'll do is because we all know what great things are in that blood and growth factors and what have you, is I'll spread it around and let it seep in. And if they're willing to go home like a nightmare, I will definitely encourage it.
And another question from the group that just popped up is what treatment has been able to distinguish the return on investment on investing in the device?
Oh gosh. So you're going to be probably charging anywhere from $800 to $2,500, depending on what you put into it. So at the price that's there, what you'll see on, as Sheldon said, it's on the MedinjecT.com, and you'll see the pricing there for the MedinjecT, but we're also giving $1,000 off of it. So when you think about in retrospect, if you have like we all know what devices are, same cost of a small property in the Midwest, but this particular one isn't. So if you're looking ROI wise, it probably brings the most ROI because, you know, if you're looking 800 to 12 or to 2,500 per treatment, that's a nice chunk of change. And if you did, you know, 10, 10 treatments a month, you're virtually paying for your machine in 2 to 3 months. And we all know we really can't say that with anything else. So that being said, it's, you know, the cost versus, you know, the benefit of this, it pays for itself relatively soon. And, you know, then you're just on your way to making money. But producing the result is the most important, because not everybody is ahead in the game, you know, on this. I find, I still find it amazing, maybe as because I teach and I have the, you know, blessing of being able to see a little bit more than the average person. But at the end of the day, the results that I see and the staggering, you know, if you look versus the Asians versus the Europeans to how we're taught here, it's almost like we're still in the dark ages. And I know a lot of that has to do with the way we're taught and what have you. But you really want to get a jump on your practice and do combination therapy. There's quite a few people that, you know, are great to watch that do things like this. I love it. I just think it takes your results up to the next level. And we all know what happens when you produce a result for your client. You know what? They're yours for life. And just educating them and letting them know is the way to bump your practice up. But I love this device. I use it in combination with quite a few. Everybody that I've had so far, and I've trained over 100 of these devices, haven't really had an issue at all, and actually loves the device once they really get using it and understanding it. And understanding it is, you know, to get that mindset out of the kind of like dark ages and just say, okay, we'll just do an IPL. Is it bad? No, it's good. It's okay. But is it the best we can do? No. You know, there's so much more we can do to combine these therapies, in which this is, you know, what came in handy in doing that and taking my practice up into, you know, to the next level.
Another question from the group here, Gigi, is that in the beginning there was the slide that came up quickly that said the 5 most common reasons why providers buy the Inject was combination therapy, hair restoration, rejuvenation therapy with exosomes, speed and efficacy, and competitive advantage. They were asking if you could talk a little bit about combination therapy and what you mean by that exactly in your clinic.
So what I mean by that in my clinic is I will do, like I said, I'll stack multiple devices together to hit all of the, you know, areas that we need to. If I'm doing skin integrity, if I'm wanting tightening, I'll take an RF microneedling. Right after it, I'll do a CO2, full blown CO2. And then right after that, I'll go straight to this and do a PRP or an exosome that has multiple growth factors. So we know that aids in the healing process as well as inducing neocollagenesis because of all the factors. So it's kind of a win-win on that area. And they heal, their heal time seems to be a little bit better, a little bit quicker when I have exosomes or a PRP. And the result is phenomenal. They come back and, you know, for their post checkup, and, you know, I have about 2 weeks, and then again, 3 months, because we all know skin cell cycle is like 90 to 120 days, and it's phenomenal. So that being said, I combine it with everything, but I can also use it as a standalone. So if they want to come in and get a little more micro Botox, you know, a couple weeks later, or they want to do just some hydration because we lose hyaluronic acid as we age. So if they don't want to use it for filler, but they want to use it for, you know, just as a hydrating, which is what I'm doing with Shannon right here. And so that being said, it's, for me, it's the Windex to the practice is kind of how I put it. Is it's Windex, Windex cures everything. That's how I look at this. I hope that answered the question.
Yes. If there's any other questions, people can send them to me directly, like you're doing, or put them in the chat to everyone. And
If you have
Gigi
any
will cover them.
questions, yeah, and if you have any
Or if you,
questions too,
or if you can go
you
unmute. Actually, if you want to just go unmute. Actually,
Mhm.
Stacy, I noticed that you have the device, and maybe if you don't mind unmuting, maybe you could talk a little bit about how the treatment is going in your clinic as well. I don't know if you're in a place where you can unmute right now or not, but there we go.
How are you?
We just passed our 1 year, so super excited. We're
Oh,
looking
good.
within the MedinjecT. That's why I'm kind of excited about today. But that machine feels so light in your hand, like it just molds effortlessly
Yeah.
into your hand. It is not backbreaking. Feels great on the wrist.
Right. It's not like holding a heavy handpiece that you're used to with a laser, what have you. So if you can see, yeah, Maeve can pan up and see my hand. I'm barely holding this. I don't even have a grip on it. I just simply put it right here. I'm not even holding anything. It does the work. So I'm not putting any pressure or driving that into Shannon.
And Stacy, while we got you on the line here, do you have any questions for Gigi in terms of follow-up stuff after using the device, as long as you've been using it for?
We're just looking for more things to put in it. We just brought on exosomes.
Yay!
2 months ago, we brought exosomes on, so we are very excited about that. So we're kind of just expanding more injectable things. So
and you're going to love it when that 25 comes out. You're going to be able to do some of the biostimulators much more evenly, as if they're fanning through and what have you. That's going to be a big bonus.
Yes, I'm very excited about that one.
Yeah, and so it just kind of takes down some of the work, cannulas, the what have you. It just makes it much easier to get this done. And
I feel Botox. That is something that we do. Botox. We do Botox and what? Are you hyper diluting the Botox and then using it like a
Yes. Okay. 5-1. We're doing it after. It actually helps with pore size. It's actually under a clinical trial for it right now for pore size. So you will notice that some of your acneic patients that suffer with, very large pore size, I'll hyper dilute it and do, 5-1 and then put it in like 2-3 cc's, go through the whole face, or I'll take half of a Versa, or half a cc of the Versa, and then I'll mix that in, hyper diluted, and drop in 20 units of the 5-1, and I will go ahead and administer that throughout the entire face. And because it's hyper diluted, it's not going to cause a ptosis anywhere that you really wouldn't put it, and I can go in all those areas.
You're using the diluted with what you're diluting with. Okay.
So I do it at 5-1, and then when I dilute and hyper dilute everything else, I'll just take an open part of the syringe and I'll drop in 20 units of the hyper diluted Botox, and then I'll go ahead and you can use any neuromodulator, and then that goes throughout the entire face, neck and chest. But it really does help with the pore size for sure. Yeah, so that's a good one. We like the what's that?
Some of the older ladies to prevent like the brow ptosis and stuff.
Yes, it will, and I don't use it as I'm administering, neuromodulator that I'm going to do with a, of course, a needle and syringe single, if I'm using it for a neuromodulator. But I do find that it does give a little lift, and it does give it like a little lightning brightening. I can put it in with a glutathione too, and it's actually a really good result. So that being said, it's, like you said, I'll be sitting there at 3 o'clock in the morning going, "Ooh, I can put this in there," or hence my turkey basting, just for giggles. but at the end of the day, I can.
An IV. What are you doing in the auto-injector?
As far as exosomes?
No, for the glutathione.
Oh yeah, the glutathione is the same thing you're using the IV.
Okay.
Yeah, 100%. Just pull up X amount of it, 2-3 cc's, and do the whole face, face and neck.
For diluted,
and you can do
that's normal.
No, just as normal with the glutathione. Vitamin C, I do the same thing. So you can actually help, fight the free radicals, but that also helps with the lightening, brightening. We know that the vitamin C does, aids in anybody who has hyperpigmentation. Topical vitamin C is always great, but it's good to actually have it, in the MedinjecT done. So there's all kinds of different little things. And then when, if you purchase, I come out, I train, I do these, I give a little booklet of things that I do and put in there. It's like a little cookbook, if you will. And then, you'll go through your practice. I have 2 great plastic surgeons now that are working on like nano fat transfer and what have you. And it's amazing. Okay. So we're all, see, didn't take me how long, mate?
Gigi, along those lines, I got another message here that if you could expand a little bit on what training day would look like.
Okay, so training day for me, on the parting gift, I get to come in and we'll pick X amount of, patients that you have that you'll want, something that you think you're going to use in your practice quite a bit. Thank you so much, Shannon, for letting me poke at you. You're all squared away. Come back over here. Yeah, I think usually I'll say, hey, who do you want to pick and what are their issues? We find out beforehand so that when they come in for training, you'll be able to do these full treatments on them so that you'll know what it's like and how it fits in your practice when I leave. So, and I'm always available because I do own the training company too. So I'll always be available to you via email, text. If you have any questions, even after this, you can go to gigitrainer1@gmail.com and we'll answer any questions that, you have. So say I did your training on a Tuesday and you didn't open your new practice for another, 3-4 weeks. I'm not going to leave you high and dry and go, oh girl, your training day's done. No, I will answer the questions and help you through it and, continually, because like I said, new things come out and we're like, hey, can I do that? Can I do that? We all know that as practitioners. So absolutely. I'm more than happy to get on the phone with you. I'm more than happy to spend the day with you when I'm training and we take different things and do, different particulars. We can do PRP. What do you have in your practice? We'll sign up for that. So then when I get there, it's go time and we do the procedures that you're going to think that, make your practice thrive. And then some new ones as well. So anything you think you want to put in, we'll go for it and we'll do it.
Excellent. If there's any more questions from the group now, we're going to open it up to Q&A. So, we've been doing questions along the way, but if you want to jump in, turn your video off or mute or audio off and ask a question, we're opening it up to that. Or if you like, just send it through chat, that's fine too. So I'll wait to see if anything pops up on that end. And in the meantime, maybe we'll switch over while we're waiting for that to the economic benefit, just the pricing and so forth. So I'm just going to quickly share my screen here on that information. So, yeah, sure.
Hi, Gigi came out and did our training. I'm a nurse. We are from medical backgrounds. We are not from an aesthetic background. So she was very patient and had to break things down to us on a different levels. She's an amazing trainer and she was very patient.
Oh, thank you.
But we had a lot of questions and
that's A-okay. That's my job. Yeah, we get every, and even if our people that are advanced injector, it's something new. And when there's something new, there's always something to teach.
Very nice. Very nice. Thank you for sharing that.
Thank you.
I am working here at just pulling up my screen to share here on pricing questions. So hopefully we should be able to see this in a second. Just give me one moment. There we go. Okay. So real simple device lists for around $30,000. The sale price on theinject.com when you go online is $22,875 plus shipping, tax, and training. For joining the webinar today, we have everybody's email. We know who joined. You get a $1,000 discount if you take action this month. So the price is $21,875 plus shipping, tax, and training. So on the financing side, if you finance it, it's about $500 a month estimated. or we will consider short-term internal financing for less than 4 months or less. So Gigi touched base earlier on the ROI. It's really based on all the treatments that you can add versus using a single syringe.
Yeah.
And I'll just open that back up to full screen and get off my screen now, and say that it's probably the two most things that we hear the most is the combined therapy, and then also hair restoration as well, that a lot of providers weren't even considering doing before.
Yeah, and I exactly. We're not a hair restoration place, but when you figure out you have all these women coming into your practice, because we all know it's mainly women, a lot of men as well now, but women coming in, and anybody who's got, and anybody who's perimenopausal, menopausal, post surgical, there's always a hair loss issue, stress, nutrition not where it should be because we're always on the go. It just started ending up being, when we were talking about it, that women, especially around, the hairline, would see it the most. And so we started picking up on doing, hair restoration. We were doing it with PRP anyways. So we started doing that. We use a lot of exosomes. We use a lot of post-procedure exosomes as well as for hair restoration. So I would say that's a huge, opening to another avenue in your practice that maybe you weren't thinking, because we all tend to think on the face, or body. But that being said, all the new thing, it comes with the education. And so when I say, hey, or if I do pricing, I'll do a pricing on saying, hey, we're going to do a package, therapy for you. And I'll include in my thought process. So because sometimes if you're looking at someone and you find that they're difficult because they don't know what they don't know. Sometimes I'll take my pricing of my PRP, or an exosome, and put it into the pricing of the package that I'm giving. So it doesn't seem like that they're getting the full, everything they wanted, but they're not thinking, oh, I just paid for CO2 and RF microneedling and I'm doing this. So I'll incorporate it into the costs, as a bundled deal where I'm also covering, my costs and, the practitioner and what have you, but also they're getting this result. And once they start looking at these results that they're getting that they didn't get anywhere else, because it is, apples and oranges, it's a phenomenal result, that they're going to start looking and going, yeah, I didn't just get this from an IPL. I got this because there was a plan. And this is what I incorporate a lot into, a plan that I'm taking them on, because it's never going to be a one and done. It's like what happens when you stop going to the gym. There goes the muscle mass. Here comes the weight. It's an ongoing process. And I try to educate all my patients that way. It's never going to be a one and done. And I give those analogies so they go, oh, because they all tend to want to say, hey, how long is this going to last when you do the procedure? I'll say, as long as you keep it up. Just like your nails, just like your hair, just like everything else. So they need those little bumps of information and, analogies to go, oh, yeah, okay, you're right, but the results with it, they love. And if you give them a result, they're yours forever. I'd follow my hairdresser to a back alley in Tijuana if she went. So just that kind of rapport that you get with them by delivering them results is, phenomenal. So I can't wait for the 25 to come, because my head's already spinning. I'm like, I'm gonna do biostimulators in my entire body. I'm gonna bring it home. So, all of these things that keep coming. And, as we know, the evolution of aesthetics is, always, because there's always something new. So I'm sure there's more new things coming down that we don't even know about, a year or two or whatever, that we're going to be able to put in it as well. So it's going to be the gift that keeps giving.
Yeah, really an ongoing process in terms of all the ways that
Correct.
it can be used and utilized, and the versatility of it, and more to come, like you said, with a new tip coming down the pipe. And just so to re-hit that, there are two different tips, one for the hair restoration, that's a 5 needle, and the one for the face, it's a 9 needle. Now that we're going to a 25 gauge needle, it'll be really exciting in terms of where we'll be able to use that as well. So we really appreciate your time, Gigi. Thank you so much for doing that live demonstration. That was huge.
No worries.
And if anybody has any follow-up questions, one thing I'll say is you can go to theinject.com. Gigi's contact information is right there, or get with the person that invited you on here today. Or if you don't know where to find them, you can contact us for Gigi as well, and we'll make sure you're taken care of. So thank you, everybody, for joining. We really appreciate it.
Thank you.
And
Hope to
hope
see you all
everyone's doing
soon.
well. All right. Take care.
Take care.
Bye.
Bye-bye.